Thank you, Mr. President. Since the passage of Resolution 2401, the Secretary-General has on many occasions called for its full implementation. However, rather than implement the resolution of this Council, we've seen parties to the conflict sustain intense military activity at an enormous human cost. Today, we've been asked to provide an update on the humanitarian situation in Raqqa and Rukban. We have also been asked to cover humanitarian issues in Syria at large, particularly in Ghouta, Idlib, and Afrin. Let me start with Raqqa City and Rukban. The population of those two places total only about 1% of the number of Syrians in need of humanitarian help, but their needs are no less important than those of the 99% of their compatriots needing assistance in other parts of the country. Mr. President, on 1 April, the United Nations undertook an assessment mission to Raqqa. Since ISIL was forced out of Raqqa in October, nearly 100,000 people have returned to Raqqa City. However, conditions are not conducive for returns due to the high levels of unexploded ordnance and improvised explosive device contamination, widespread and severe infrastructural damage, and a lack of basic services. Every week, there have been over 50 casualties reported due to remnants of war. With the onset of spring, there's a concern that children playing outside are particularly vulnerable. An estimated 70 to 80% of all buildings in Raqqa inside the city are destroyed or damaged. While public services are slowly resuming, with at least 37 bakeries operational, for example, the city lacks electricity and mobile communications, and water is only pumped at a very limited capacity to the outskirts of the city. Up to 95% of households who've returned to Raqqa are food insecure. Health services are lacking or severely limited. Some schools have reopened, though they're lacking school materials and other supplies. Following the 1 April assessment, United Nations agencies are planning deliveries of humanitarian assistance and programmatic interventions. This response will support the ongoing activities of humanitarian organisations already active in Raqqa, who are providing food, health and other basic services. It will also complement the ongoing response for those displaced and in need across northeast Syria, where nearly 900,000 people receive assistance each month. Mr. President, in Rukban, some 50,000 people continue to be in need of sustained humanitarian assistance. Water and basic health care are provided from Jordan, but there's a pressing need for better service provision and, in some cases, for referrals elsewhere for medical help. People in this area last received assistance delivered from Jordan in early January. Government of Syria approval for a UN interagency convoy from Damascus to Rukban was received on the 18th of March. Humanitarian agencies are working closely with the United States, the Russian Federation, and the Syrian Arab Red Crescent to make this delivery possible, noting the importance of finalising arrangements for the safety of the operation, as current security guarantees only permit movement to an area some 10 kilometres outside of Rukban. Discussions continue on how aid can best be delivered, providing safe delivery of life-saving help to those in need. Mr. President, the town of Douma and other areas in eastern Ghouta are now under the control of the government of Syria. After years of deprivation under siege, those who remain in this area continue to require urgent assistance that we as the humanitarian community have yet to be able to provide. Access to reach the people throughout eastern Ghouta is critical. The UN and partners are responding to the mounting humanitarian needs of the 155,000 people displaced from eastern Ghouta, with food, shelter, health and other assistance and protection services. However, for both those in overcrowded IDP sites around eastern Ghouta, as well as those who left on buses for Idlib and Aleppo governorates, the situation is precarious. Of the 155,000 people who've been displaced, about 63,000 have moved north to Idlib and Aleppo. They join the nearly 400,000 people who are displaced from southern Idlib since 15 December. As a result, there's been a 25% increase in Idlib's displaced population, with 1.2 million of the 2 million people in the governorate now displaced, many of them multiple times. This extreme situation places incredible pressure on the host communities and on the humanitarian actors working cross-border to provide assistance and services. Fighting among non-state armed opposition groups in Idlib further complicates the situation for those in need in the area. Those remaining in Afrin, as well as the 137,000 people who are displaced to government-controlled Tel Rafat and the surrounding areas, are also in dire need of humanitarian aid and must be granted freedom of movement. This includes those who need medical evacuations from Tel Rafat to nearby Aleppo. Between 2 and 4 April, several Turkish-facilitated UN cross-border shipments consisting of food supplies, health, and other relief items were sent to assist people in need in Afrin district. On 25 March, the United Nations and the Syrian Arab Red Crescent delivered assistance to 50,000 people in need in Tal Rafat. While these are positive developments, overall, humanitarian partners are still struggling to gain sustained access to Afrin, and freedom of movement for internally displaced people remains very limited. On 25 March, the United Nations submitted a request to the Syrian authorities for the deployment of an interagency surge team to scale up the UN's operational capacity in Syria. Response to the request for an additional 17 UN staff to be deployed for a 4-week period was received on 11 April, authorizing the deployment of 12 UN staff. As we approach the conference in Brussels on 24 to 25 April, we have an immediate opportunity to progress on easing the humanitarian suffering by fully funding humanitarian operations. With an appeal that's currently less than 15% funded, I cannot overstate the importance of sustaining and scaling up the international response. Thank you.